Hi, I'm Dr. Sivaraj, Senior Consultant from the Department of Internal Medicine Diabetology, MGM Hospitals. Today I'm here to talk about the seasonal infection. There are two seasonal infections which are commonly being seen right now. One is a dengue infection, that's a dengue fever. Another one is a seasonal flu. As the name indicates, both are viral infections which usually presents with a very high-grade fever. How to differentiate between the two? The second one is also a high-grade fever, but it presents with flu-like symptoms like throat pain, running nose, cough, and breathing difficulty. Dengue fever is a viral infection. It's usually a self-limiting disease. It's a viral infection which is spread by mosquitoes. There are 4 serotypes of dengue virus. This virus is more common in the tropical as well as the subtropical countries. What are the clinical manifestations? Dengue infections is usually called a breakbone fever. It presents with a high-grade fever. When I say high-grade, the temperature is usually more than 101 degree Fahrenheit. As I told you, it's a breakbone fever. The patient usually has got a very severe body pain, joint pains, severe headache, and a retro-orbital pain, which is nothing but pain behind the eyeballs. And also patient presents with a rash as well. According to WHO, the dengue presents as 3 ways. One is a simple dengue fever, the second one is a dengue hemorrhagic fever, and the third one is a dengue shock syndrome. So, in dengue fever, the usual manifestations of high-grade fever are there. But in hemorrhagic fever, you get something called hemorrhagic manifestations, which is nothing but bleeding. Bleeding can be an external as well as an internal bleeding. Bleeding can be manifested in the skin in the form of petechiae or from the mucosa like bleeding gums. You get blood in your vomitus, blood in your motion, and also in case of a female, you can have blood from your vaginal, that's vaginal bleeding. And in case they are menstruating during the dengue fever, they can have an increased menstrual flow of blood as well. The third variant is nothing but a dengue shock syndrome, where because of the bleeding manifestation, patient goes in for a circulatory shock or a collapse, where there's fall in BP and a multi-organ damage, which causes increased mortality. Usually this dengue fever lasts for around 7 to 9 days, goes through 3 phases. The first phase is usually called the febrile phase or the fever phase, which usually lasts for about 4 to 5 days. The second phase is called the critical phase. As the term indicates, this is usually the critical part of the infection, which usually lasts for around 4 to 7 days. The third phase is nothing but the recovery phase, which starts from the 7th day. During the critical phase, there is no fever. There's a fall in the counts, that is the WBC count and the platelet counts, which usually falls to a minimum, and from the 7th day, it starts recovery. The diagnosis of this infection is usually by a blood test, which detects the antigen as well as the antibody. We usually do the dengue NS1 antigen, which detects the virus, which within about 24 to 48 hours, and you have the antibody test as well, which detects within about 4 to 5 days. The treatment is usually conservative and is usually symptomatic. There are no specific medicines for dengue. It's usually more of fluid management and supportive care, and unnecessary medications are avoided. In case of dengue hemorrhagic fever and dengue shock syndrome, the patient needs to get admitted and blood products are usually transfused if required. The take-home points and the take-home messages are: when does the patient need to get admitted? There are only 5 red flag signs the patient needs to monitor, whether it requires an outpatient management or an inpatient management. If the patient has got severe abdominal pain with abdominal distension, as I told you, hemorrhagic manifestation like bleeding gums, blood in the vomiters, blood in the motion, or increased menstrual flow of blood, low platelet count, which is manifested, and in case of children and elderly, if they are really lethargic, drowsy, and breathing difficulty, these are usually the 5 red flag signs the patient needs to look into and get admitted as soon as possible. Thank you.